If you're listening to this right now in a quiet moment, perhaps in the morning or after you've finally sat down to rest, there's nothing you need to do straight away. This isn't a warning, it's not a medical lecture, and it's certainly not here to rush you into changing anything. This is simply a slow, respectful conversation about something very familiar: blood pressure. After the age of 60, many people find themselves living alongside numbers. Numbers on a monitor, numbers written in medical notes, numbers mentioned at every appointment. And even when the doctor says everything looks okay for your age, there can still be a quiet feeling that lingers. Not panic, not fear, just a sense of not quite feeling settled. Most advice focuses on medication, diet, exercise, and stress management. All of those matter. They truly do. But there's one part of the picture that's incredibly close to us. Free, always available, and already part of our daily lives. Yet rarely explained in a calm, practical way, the way we breathe. That might sound almost too simple. And it's understandable if you feel a little skeptical. So let's be clear from the beginning. This is not about replacing medical care. It's not about ignoring prescriptions. And it's not about chasing quick fixes. What this conversation is about is understanding why breathing can influence blood pressure, when it's helpful, and how to use it gently, without dependence, without forcing anything. Because after 60, health isn't about doing more and more. It's about understanding what already belongs to you and using it wisely. Over the next little while, we'll take this step by step. We'll talk about why certain breathing patterns can lower blood pressure quickly, how the nervous system responds almost immediately, and how simple, steady practice can support your body rather than fight against it. Nothing dramatic, nothing extreme, just calm understanding, so you can feel a little more at ease. Let's begin there. The first thing worth saying clearly is this: breathing is not a miracle cure. It doesn't replace medical care. It doesn't cure high blood pressure. And it doesn't mean medication is unnecessary. What breathing does have, however, is one very specific and very real ability. It acts directly on the nervous system that regulates blood pressure. And because it works through the nervous system, its effects don't require long periods of time, not weeks, not months, sometimes just minutes. No prescriptions, no cost, no equipment, just the right approach. This matters particularly for people who have been taking blood pressure medication for many years, yet still notice fluctuations linked to stress, worry, or certain moments of the day. First thing in the morning, during appointments, or late at night, when the mind won't settle. In these situations, breathing isn't competing with medication. It isn't trying to do the same job. It supports the body from a different angle. Medication works chemically. Breathing works neurologically. When the nervous system is calmer, blood vessels respond differently. Pressure shifts. The body becomes less reactive. For many people, this means their medication can work more steadily, instead of constantly fighting against spikes, triggered by tension or shallow breathing. The question then isn't, should I be breathing? Of course you are. The more useful question is, how am I breathing most of the day without even noticing? Many adults spend years breathing quickly, shallowly, and unconsciously, especially under quiet, ongoing stress. That pattern sends a continuous message to the body: stay alert, stay tight, stay ready. Over time, blood pressure follows that message. Learning to breathe differently isn't about forcing relaxation. It's about giving the nervous system a signal it understands. A signal that says, you're safe, you can ease, you don't need to push right now. That's where real change begins. not dramatically, but steadily, and without resistance. And from here we can look more closely at why this works. The human body is guided by a remarkably sensitive system known as the autonomic nervous system. This system operates quietly in the background, without conscious effort, yet it plays a decisive role in everyday health. It determines whether blood vessels tighten or relax, whether the heart speeds up or slows down, and ultimately, whether blood pressure rises or settles. One of the strongest inputs into this system is breathing. When breathing becomes fast, shallow, or irregular, even if it's caused only by worry, overthinking, or rushing, the nervous system interprets this as a sign of stress. The response is automatic. There's no choice involved. Stress hormones are released, blood vessels narrow, heart rate increases, blood pressure rises. This response evolved to protect us in moments of danger. But when it happens repeatedly, quietly, day after day, the body stays in a state of mild alertness, even when there is no real threat. Now consider the opposite. When breathing slows down, deepens, and becomes more rhythmic, the message to the nervous system changes entirely. The body receives a signal of safety. The relaxation pathway is activated. Blood vessels begin to widen. Heart rhythm steadies. Blood pressure naturally starts to come down. What matters here is not intention, belief, or positive thinking. This is not a mindset technique. It's basic physiology. The nervous system doesn't respond to what we hope will happen. It responds to signals. Breathing is one of the few signals we can consciously adjust, and the nervous system listens immediately. That's why the effects of proper breathing can be felt within minutes, not because something magical is happening, but because the body is doing exactly what it's designed to do when it senses calm. Understanding this is important because it removes pressure. You don't have to try to relax. You don't have to convince yourself of anything. You simply give the body a clearer signal, and it responds accordingly. This shift, from guessing to understanding, is what allows calm to replace anxiety. And once the mechanism is clear, the techniques themselves become much easier to approach, without fear, effort, or resistance. The first technique is called 4-7-8 breathing. This is a method designed for everyday use, especially during moments when tension builds quietly. Not panic, just that familiar sense of tightness in the chest, shoulders, or head. The steps are simple and structured, which is part of why it works so well. You breathe in through your nose for 4 seconds. You hold the breath gently for 7 seconds. Then you breathe out through your mouth for 8 seconds. Nothing is forced, no strain, no effort to do it perfectly. The key element here is the long, slow exhale. That extended out-breath sends a clear signal to the nervous system that it's safe to slow down. For many people over 60, the response is noticeable quite quickly. The heart rate begins to ease. The shoulders drop without being told to relax. The jaw softens. The head feels lighter, less pressured. Some people choose to check their blood pressure after a few rounds and notice a small drop, sometimes 5, sometimes 10 points. Not every time, not for everyone, and that's not the point. What matters more is the shift in state. You can feel that the body has moved from alert to settled. This technique isn't meant to chase immediate results. It's meant to train the nervous system. When practiced regularly, once in the morning, once later in the day, perhaps before sleep, the body begins to learn something important. It doesn't need to react so strongly to every stress signal. Over time, this creates a calmer baseline. Stress still happens. Life doesn't become silent or slow, but the nervous system recovers more quickly. Blood pressure becomes less reactive. The body doesn't stay tense longer than necessary. That's why this technique works best when it's treated like a daily habit, not an emergency tool. Just a few minutes, a predictable rhythm. A way of reminding the body how to settle itself again. You don't need to believe in it. You don't need to analyze it. You simply practice and let the body respond in its own time. This is the foundation technique. Gentle, reliable, and easy to return to. In the next section, we'll look at a second breathing method that's even quieter. One that blends seamlessly into daily life and helps maintain steadier blood pressure over the long term. The second technique is called resonant breathing, sometimes referred to as 5-to-5 breathing. It's even simpler than the first. You breathe in gently for 5 seconds. Then you breathe out for 5 seconds. There's no breath holding, no complex counting, just a smooth, steady rhythm. This pace, 6 breaths per minute, is considered an optimal frequency for the cardiovascular system. At this rhythm, the heart, blood vessels, and nervous system begin to move in sync. Researchers sometimes describe this as the heart and breath finding the same rhythm. In practical terms, it helps blood pressure become less reactive over time. What makes this technique especially valuable is how quiet and discreet it is. You can do it while watching television, while sitting in a waiting room, while lying down in the afternoon, even while standing in line. No one around you needs to know you're doing anything at all, but your body knows. Unlike emergency breathing techniques, resonant breathing isn't designed to bring numbers down quickly. Its role is different. This is a maintenance practice. It reduces the swings, the sudden rises triggered by stress, anticipation, or anxiety. It helps the nervous system stay closer to center, rather than jumping from calm to tension and back again. Over time, many people notice that their blood pressure readings become more consistent. Less fluctuation, fewer surprises. This matters because for most people after 60, it's not the average number that causes concern. It's the unpredictability. Resonant breathing doesn't demand effort or discipline. It fits into life rather than interrupting it. 5 minutes in the morning, 5 minutes in the evening, or even a single longer session when you're resting. It's the kind of habit that doesn't feel like a task, just a rhythm the body begins to recognize. If 4-7-8 breathing helps you settle when tension builds, resonant breathing helps you stay settled. In the next section, we'll look at a third technique, one that's used very differently. Not for daily practice, but for moments when blood pressure spikes suddenly and you need a way to steady yourself quickly. There are moments when blood pressure rises not because something is physically wrong, but because the body has slipped into panic mode. The heart starts racing. The head feels hot or tight. Thoughts speed up, and very quickly it can feel as though things are getting out of control. In those moments, logic doesn't help much. Telling yourself to calm down rarely works. This is where alternate nostril breathing becomes especially useful. This technique isn't about long-term training. It's not about improving numbers over weeks. Its purpose is much simpler and much more important in the moment. It helps pull the body out of the danger zone, not to make the readings look perfect, but to interrupt the cycle of stress, rising pressure, fear, more stress. Alternate nostril breathing works because it does 3 things at once. First, it forces the breath to slow down. You physically cannot rush this technique. Second, it demands gentle attention. The brain has to focus on which nostril is open, which is closed, when to switch. That focus pulls attention away from catastrophic thinking. And third, it sends a clear signal to the nervous system that balance is being restored. In simple terms, it tells the body, this moment is being handled. The technique itself is straightforward. You use your right hand, gently close one nostril, breathe in through the other. Then switch, close the opposite nostril and breathe out. Then reverse the pattern. The breath stays slow and comfortable. There's no strain, no breath holding. Within a few minutes, many people notice that the heart rate steadies. The sense of urgency softens. The feeling of panic loosens its grip. Blood pressure often comes down. Not always to ideal numbers, but enough to move out of the range that feels frightening. That shift matters, because once panic settles, the body can regulate itself again. And decisions can be made calmly instead of reactively. This technique is best thought of as a rescue tool. You don't need to use it every day. You don't need to practice it for long periods. But when stress hits suddenly, when anxiety pushes blood pressure up quickly, this is the technique to reach for. In the next section, we'll step back and look at how these three breathing methods work together. Not as isolated tricks, but as a simple supportive system you can rely on. The real value of breathing lies not in doing everything all the time, but in using the right technique for the right moment. This isn't about adding another routine to manage. It's about having a simple system you can trust. On most ordinary days, the foundation is gentle and steady. That's where 4-7-8 breathing and resonant breathing fit best. Use them daily, even when you feel relatively well. They help train the nervous system to stay calmer by default. Over time, this reduces how sharply blood pressure reacts to stress. When tension builds during the day, an uncomfortable conversation, worry creeping in, a sense of being rushed, adding a few rounds of 4-7-8 breathing is often enough to reset things. Then there are moments that feel different, sudden spikes, racing heart, that unmistakable feeling of panic. Those are not moments for discipline or long routines. That's when alternate nostril breathing becomes useful. Think of it as a safety tool, not something you practice constantly, but something you reach for when the system needs help settling quickly. The key principle is this: don't do everything, everywhere, all the time. Breathing should support your life, not dominate it. Used calmly and intentionally, these techniques create stability, not dependence. In the final section, we'll bring everything together and talk about how breathing fits alongside medical care, not against it. There is one point that matters more than anything else, and it deserves to be said clearly and calmly. Never stop or change your medication on your own. Breathing is not in conflict with medical care. It doesn't compete with doctors. It doesn't replace treatment. It stands alongside it. When breathing is used correctly and consistently, it supports the nervous system. It reduces unnecessary stress responses. It helps blood pressure become more stable rather than reactive. And over time, that stability can open the door to safer conversations. Many people who practice these techniques regularly don't rush to change anything. They simply notice how their body responds. They track their readings. They pay attention to how they feel. And then, with their doctor, they review the picture together. Sometimes nothing changes. And that's perfectly fine. Sometimes doses are adjusted gradually, carefully, with supervision. That is the only safe and sustainable path. The core idea of this channel is simple. Understanding leads to calm. Calm creates space, and space allows better decisions. Breathing is not about control or perfection. It's about giving your body clearer signals, especially in moments when it feels overwhelmed. If this conversation felt steady rather than urgent, if it helped you feel a little more at ease with your body instead of fighting it, you're very welcome to stay. We'll continue these conversations slowly, respectfully, and without pressure, always meeting the body where it is now, not where it used to be.